Imagine yourself being locked in an aluminum tube at 30,000 feet with somebody who has Ebola. That's what some flight attendants could be facing. But are they prepared? Joining me now, Sara Nelson, the president of the Association of Flight Attendants. Sara, thanks for joining me. How big is the risk in your view for flight attendants?
Well, the reality is that coming into contact with the Ebola virus on board the aircraft is highly unlikely. But as long as there is any risk, we have to take this very seriously, and we have to act expeditiously to have procedures and equipment in place to be able to respond in the event that we encounter this on board the aircraft.
Do you guys have any medical training?
We have training. We are aviation's first responders, and we're charged with the safety, health, and security of the passengers in our care. And our medical training is about immediate actions, and it's about calling for health care assistance. And whether that's on board the aircraft or calling to the ground to get assistance to respond to any medical issue on board. But we're not health care providers, and we're not trained to be health care providers.
And should you know, I understand the CDC is talking about having some of you wear protective clothing. Is that an answer? Should you be doing that just as healthcare professionals do?
Well, we absolutely should be. The reality is that if we come in contact with the Ebola virus on board the aircraft, it's most likely that flight attendants, my flying partners, our members, are the ones who are going to come in contact with that person. And we need to have protective gear on board the aircraft. This is one of the things that our union is calling for, is for universal precaution kits for each member of the crew and 2 additional for any medical or healthcare providers who may step forward to assist us during the flight.
And what would that consist of?
That consists of medical non-allergenic gloves, a face mask, an apron, equipment that would dry up a small amount of a liquid spill and contain that, sanitation wipes, and a surgical mask.
You know, Sara, I ask myself every time I fly, just how clean are these planes? Are they scrubbed down frequently or no?
Well, this is a real concern for us. It used to be that the airlines employed cleaners, and there was a standardized process, and there was also concern by these cleaners who were employed by the airlines about keeping those aircraft clean. And I think that we had a higher standard of cleanliness at that time. This is all contract out work. There is not a standard that we are comfortable with, and this is one of the issues that we are calling on the CDC to continue to provide the guidelines, and for the government to really insist that the airlines are following CDC guideline for cleaning these aircraft.
You know, I would have to think that a lot of flight attendants these days are saying to themselves, and possibly among themselves in the galley and other places, boy, I just don't want to fly, or I don't want to fly particular routes, or I'm worried, or I'm nervous. How are you guys feeling right now? Are you confident?
Well, flight attendants are concerned, and anytime there's an absence of information, it creates more concern. So the reality is that it's highly unlikely that any flight attendant or any passenger would come in contact with the Ebola virus on a U.S. flight. But the reality is that this is at the forefront of our thought, because the downside to coming in contact with it is terrible. It's catastrophic. So we're thinking about this as we go to work. We're thinking about this not only in concern for ourselves and our families, but also because we are charged with the care of the passengers who are with us. So we want to know when we come to work that we're going to have a briefing on our immediate actions. And we're not seeing this happen quickly enough with the information directly hands-on for the flight attendants and reminders as they come to work, and the protective equipment on board that we want to see. And so our union is taking actions on our own to try to step this up. We have a resource center on AFA-CWA.org for flight attendants now to check for any precautions that they need to take, immediate actions that they should be taking if they come in contact with potential Ebola virus on board their aircraft.
So what is the appropriate protocol if there is a sick passenger on board? Because I read a story just this morning that on one plane somewhere a flight crew actually locked somebody who was sick into the bathroom. I can't imagine that's the normal thing to do. What's the thing you're supposed to do with somebody who's sick on a flight?
So one of the things that we need to do is get information out there, because this can cause panic, right? And the response is very direct. So you need to, as quickly as possible, find out where that passenger has been coming from. If they've been coming from an affected country, then you know that you may be dealing with the Ebola virus. If they have possibly come in contact with Ebola, you may be dealing with that. Otherwise, it's the flu season. Quite frankly, people get sick on board the aircraft all the time. Flight attendants deal with this very, very well on a regular basis. And if it's not the Ebola virus, then the flight can continue as normal. But if there is a risk there, then the first thing that we need to do is to try to isolate that passenger. Flight attendants should be donning that protective gear, and we should be reporting to the cockpit so that we can get news to the ground, and we can have the proper response when we can get that airplane on the ground.
It's just not, it's a very difficult situation. I completely understand, because your space is limited on an aircraft. There's not a lot you can do. Sarah, thank you for coming on the show tonight and illuminating this for us. It's a tough topic. Thank you.
Thank you, Jerry.